Welcome, everyone. I'm so excited to join this evening with this wonderful panel that we have before us. This is a wonderful evening where we really get to share some stories and discuss ways to advocate and navigate through the healthcare system, as well as share some patient stories here. So I'm Dr. Barbara Nye. I'm over at Wake Forest Baptist Health I should say Atrium Health, Wake Forest Baptist. I apologize, I'm one of the headache specialists, and I'm joined by this wonderful panel. I have Miss Sarah and Joseph and Yari, and I'm going to have each of them say a couple words about their roles, and then we'll kind of have their stories and their perspective this afternoon. So I'll start with Sarah.
Thank you so much, Dr. Nye. My name is Sarah Shaw. I am the Senior Manager of BIPOC Community Outreach at the Global Healthy Living Foundation. We're a nonprofit organization working to better the lives of people living with chronic illness. I also happen to be a migraine patient and a member of the LGBTQA plus community.
Thank you so much, Sarah. And Joseph, we're going to go to you next, but I forgot to put in the plug-in for our question and answer section at the end. So make sure that as the questions come up, go ahead and start typing them in, and we'll make sure we get to as many as we possibly can. Let's go to Yari for a minute, and then let's see if we can get technical support in the background there so that we can hear you, Joseph.
Hi. Hopefully you can hear me. I'm Yuri. I'm a patient advocate, and it'll be good when we all can hear Joe because he has a great voice. And I'm also part of the queer community and also disabled by chronic migraine. So just really glad to have this space to talk about the intersection of the two.
Perfect. And it looks like Joe's logging off and then back on. Hopefully we got him now. It's all about you now.
I will not be silenced. I am Joseph Coe. I have the privilege of working with Sarah at the Global Healthy Living Foundation. I have a new title since we last all met. I am the Director of Therapeutic Growth and Integration. I'm also the host of Talking Head Pain, the podcast that confronts head pain head on. And I'm unapologetically gay. So I'm really excited to be here with all of you today to talk about this important issue.
Thank you, guys, and really thank you to everyone who's joining us. I anticipate that more people will be joining in the next few minutes as we do our introduction. But again, I'm going to put the plug in for question and answers. Make sure that you're typing things in as things come up. And we're going to start with Sarah telling us a little bit more about some of the statistics of migraine and headache disorders in the LGBTQ community. And some of the support that can be offered as well.
Thank you. So I'm going to start off by saying that there's not a lot of statistics out there that have been done for migraine in the LGBTQA plus community. It's something that in recent years has suddenly been, I don't want to say catching on, but has suddenly caught the eye of people that there should be more attention brought to it. So I think it's really important that conversations like these are happening, that we encourage more people to get involved with clinical trials. We encourage people to become more involved in advocacy, but also we have to make sure that those spaces that we're inviting them to are safe spaces for them to actually be involved in. And so when I say these statistics, I know that there are more than what is shown out there, because there are so many of us in the community that either feel safe going to the doctor, do not feel supported, maybe have had really terrible experiences in the healthcare system. So there is some data that I had found from around 2013 to 2018 from the National Health Interview Survey that shows the prevalence, sorry about that, of headache and migraine was the highest actually among bisexual women, which was 36.8%, followed by, I'm using the terms that are in this article, so lesbians by 24.7%, bisexual men 22.8%, and gay men was 14.8%, while straight women were at 19.7% and straight men were at 9.8%. Obviously, This was taken from quite a few years ago, and it doesn't seem to include non-binary folks or break down trans men or women. So we're missing a lot of statistics in there of our representation from the community, which seems to be a common theme throughout our lives as well. But really, statistics aside, what I really want to focus on more is what we can be doing to support the LGBTQ plus community living with chronic migraine, chronic headaches, and headache disorders. Because I feel like for me, myself, with my own personal experience as somebody who is part of the queer community, who growing up, it was not really accepted. I actually, my dad's side of him, my dad was also gay. They didn't talk about it. It was not something that was talked about at home, and he actually, was kind of shunned from the family. And they're so myself has also been. And so when we don't have those support systems at home, there's a lot of realities of becoming distanced and losing that support. So who's going to be able to take you to the doctor? Who's going to be able to take you to get the care that you need when you are maybe kicked out or disowned from a very young age? And that wasn't my exact situation growing up, but not having that support system, not having that insurance coverage from a young age can follow you throughout life. And so I think it's really important that we have healthcare systems, doctors' offices, advocacy spaces that are inclusive, that make you feel warm and welcome, that you have that extra motive, that extra support when some of the most vulnerable communities out there are not getting the help and support that they need because they do not feel safe going to the doctors. They feel that there's a lot of stigma. When you don't have doctors' offices that use your pronoun, that have pronouns on their sheet, like when you're going to sign up for the form, or if they're dead naming you, for example, that would not really make anybody feel safe going to the doctor if they're using a name that you no longer use anymore. And so we have to have these really important conversations and move the needle forward. And I've been seeing it slowly at certain doctor's offices that I've gone to, having them put down your pronouns, sometimes, or even before if maybe they don't have it down, they ask, what are your pronouns? And that just started happening for me like 1 to 2 years ago. And so just to think about how many people have been living through this, and, we need to make these spaces more safe and more warm and more welcoming. And that's a lot of the work that I think too, having an advocate with you, having your family members with you, having people who can go to the doctor's offices with you. My partner, for example, she still comes with me to the doctor, but in the very beginning, we would get looks and stares, and when I would introduce her as my partner, that's not a nice feeling to have. We want to make sure that from the doctor to the receptionist to the person greeting you at the door, that space is safe and inclusive. So that's a big part of making sure that we are more represented.
Thank you, Sarah. And it sounds like you're doing a lot of that work in your position as well, making sure that people are supported and have a place to reach out to. And I think those resources are so impactful. Joe, I believe you are next, and you're going to be talking a little bit about access to care issues.
Yes, Sarah hit so many important points. We have the privilege at the Global Healthy Living Foundation to tackle these issues very directly, and we're encouraged to do so. One way that I've been able to do this in the migraine space is by hosting a podcast called Talking Head Pain, where I have LGBTQ plus voices on quite often. It's something that I could do to amplify this position and these ideas. One person that I spoke with this past year was Dr. Rosendale. She conducted research through a large research net called the Pride Study. And she found that social stresses and discrimination affect migraine severity and disability in the LGBTQ community. Now, as a gay person, I was not surprised by that, but it was very validating to hear that. She also, in my conversation with her on the podcast, talked about how her research through the PRIDE study showed that people that wanted to see neurologists may not have access to them. And that many people in the study, and we're not even talking headache specialists, we're talking general neurologists. And also that many people in this study used over-the-counter medications versus pharmacological interventions. So we really have to look at the opportunity to access and what that looks like. So already we're having a disparity in terms of seeing specialists, in terms of the types of interventions that we're using. But then when we do get prescribed the drugs and we're also dealing with societal stresses and trauma from discrimination, we have to deal with our insurance companies. And we have to go through this really nasty thing called utilization management. And it's how insurance companies manage us. And there's all these really fun things that they do, like forcing our neurologists or primary care physicians or nurse practitioners to do prior authorizations to justify to our insurance companies what we can use, to having to fail first on a treatment, which is also called step therapy. So stepping through different hoops or jumping through them in some ways. We would hope to flip that script and succeed first, and imagine all of the time that we would get back if we were given that opportunity. So I really want the audience here to hear that being LGBTQ adds a layer of historic and current marginalization that may impact the ways in which we access care, like Sarah talked about. We might be going to places where it's not affirming, where we don't feel welcomed. And even then, once we do get to the care, we might not be accessing the level of the treatment in the same levels. And there needs to be a lot more research done on that issue, and how utilization management might affect the LGBTQ community differently.
Thank you, Joe. And you know, for the audience, there's actually only about 700 UCNS board certified specialists in the United States. And that's always a shocking number for folks. And we have about 4 million people in the United States, the entire population, that 40 million patients that suffer from migraine at some point in their lives. So this is a huge population, and we're beginning to understand exactly the diversity within this population. And it is so important that we do this research exactly as both Sarah and Joseph called for. And I know that we're making an effort at our headache center to make sure that we're looking at studies when we're enrolling patients now at the diversity that's offered, because so many of our current research studies really are very female oriented and white oriented, and that doesn't represent the migraine population. We know that it affects every race and a diversity of genders, and we haven't fully described all of this. And so it's so important to get involved in research and advocacy. As Sarah, I believe we all joined Headache on the Hill this year, right? All 4 of us?
You did.
Yeah.
And Dr. Nye, there's one point that I want to underscore what you're saying. So you were referencing headache specialists. There's a need for general neurologists to have this information, for pharmacists to be able to be the frontline people that are going to see the overuse of OTC medications when you're checking out at the pharmacy, and nurse practitioners and primary care physicians that the majority of us are going to see. So it's really important that we use that specialized information that are the headache specialists that are so dear to those of us in the community, use that to inform the more general medical field, so that LGBTQ people who are marginalized, who will never get to see a headache specialist, unfortunately, will get the same level and proper care.
Agreed. And I have to say there's been a national movement within the American Headache Society to make sure that we're educating primary care providers, nurse practitioners, and neurologists. There's several outreach programs. So there is a national effort to make sure we are spreading the education. Joe, you touched on prior authorizations and how difficult that process is. I must spend at least 5 to 10 minutes, depending on which patient I'm talking to, just warning them about the prior authorization process or describing why I can select one medication course versus another, unfortunately. And this is nuance. I've been in the field over 10 years, and I can't even imagine I can imagine because I teach fellows. And so I'm teaching the next generation of headache providers, but it's always this awe moment of, wow, we're not trusted from an insurance perspective. We should be trusted to make recommendations as physicians, and not just as a headache specialist, but even our primary care and nurse practitioner colleagues. So you're fighting.
How discouraging, Dr. Knight, how discouraging it is if you're an LGBTQ person who has had barriers to get to a healthcare provider. And then once you're at that healthcare provider and you've gone through all that work to get there, and you're slapped in the face by your insurance company and you're taking time away from your provider to deal with this, as opposed to your provider learning more about the LGBTQ community, learning more about their field. They have to learn how to dance with an insurance company that's trying to stop us from feeling better. It's really an unfair thing, and doesn't contribute to the stress, doesn't alleviate the stress and trauma that marginalized people face. I'll stop talking. I could go on forever. This gets my blood pressure and heart rate up.
You and me both. And, this was supposed to be a conversation, and I love how it's developing, but I want to get Yuri in the mix here and make sure that we get her perspective as a patient advocate and talking a little bit more about social support. So let's hear from you, Yuri.
Thank you. Yeah, I could spend the rest of this time also going over all the treatments that have been denied beyond being a patient advocate for 10 years. And it is awful. But right now, I want to speak to, what it is to be queer with migraine and how we can kind of help ourselves amidst this healthcare system and this society. So when I started learning about disparities in healthcare and migraine a few years ago, then I was like, why aren't more groups talking about this? We have to end these disparities. We have to change this. We have to talk about this. So I'm really grateful for places like Talking Head Pain and this panel where we can highlight these disparities. It's because of the striking statistics that Sarah shared a little bit. There's one statistic, and I totally agree, there's not enough research. It's just starting out. But one study showed that we are 58% more likely to have migraine than people who identify as 100% heterosexual. That's just like astounding to me. And then these barriers that Joe is talking about. And the more I learn about the need for safe spaces and a calm nervous system for our migraine brains, the more I want to push past my own discomfort and nerves that I'm having right now and have these conversations. I really agree with Sarah about the importance of social support. Social support is a key piece of the treatment pie. The treatment pie says that we need not only basics like exercise, food, diet, maybe nutrition, we do need nutrition, but maybe medication, maybe therapy. But we also need things like social support for our mental health, for our migraine brains. So having all of these pieces of the treatment pie can help us have a better quality of life with something like chronic migraine, or keep us mentally healthy if we have something like generalized anxiety or depression or other mental health diagnoses. So I've felt how important social support is. But then I got turned on to the concept of social safety and its impact on health. And that really made everything click together for me. And I have to thank Sarah for introducing me to Joe, who introduced me to Dr. Rosendale, who he mentioned, who sent me the social safety theory. And it's just like bit by bit, as we make these connections, I feel like we can help each other. So the idea that repeated stress or traumatic events from being marginalized has been around in research for about a couple decades, and it has been proven to have a negative impact on mental health, but physical health outcomes haven't been clearly correlated. And then people began to look at social safety. So social safety theory says people who are marginalized have better health outcomes if they have social safety. Social safety is reliable social connection, inclusion, and protection. And I just want to say that again for myself too. Social safety is a reliable social connection, inclusion, and protection, which are core human needs, and they're all threatened by stigma. So when I think about a study like Sarah was talking about that really broke down the different sexual identities and was saying, according to this language in the study, that bisexual women have the highest prevalence of severe headache or migraine and that gay men have the lowest, I'm thinking, okay, well, with social safety and maybe having reliable social connection, inclusion, and protection, that kind of makes sense to me. Social safety exists or doesn't exist in different areas of our lives, like Sarah was talking about, within family, at school or at work, in the community, in the media, we see everywhere. And social safety, of course, provided by laws and procedures. Social safety theory says the absence of social safety is just as harmful on the health of stigmatized people as the presence of marginalized stress or trauma. Because when you feel unsafe, you're constantly vigilant for threats. You're increasing your monitoring of yourself and others, and that can lead to negative long-term effects on cognitive, emotional, and immunological functioning. So examples of social threats and social safety, a threat would be experiencing for yourself or seeing bullying or threats of sexually and gender diverse people versus seeing people condemn that mistreatment or discrimination. That's social safety. So from all this, I feel like we can really help each other and help ourselves by building and creating more safe spaces to be fully yourself and not have to constantly monitor how you speak or look to avoid being harmed. And if we encourage people to speak up for each other, to speak up for us, that's creating social safety, and that can create better health. I really encourage everyone to find those people within your personal relationships that let you be fully you, the people who don't judge you or put you down, and let go of trying to fit into spaces. That's something I've done for a lifetime and struggle with, but the more I learn, the more I'm like, okay, let this go. Find the people that make you feel seen, heard, and appreciate you, that you don't have to shrink down or hide any parts of yourself. Let go of those toxic relationships that aren't helping you. I think those moments of being more relaxed and being yourself, of letting the guard down that you don't even realize you carry all the time, that's the essential stuff. That's the stuff that's going to lower your cortisol levels, maybe allow you to be in your parasympathetic nervous system, the rest or digest, the calm nervous system, maybe lower the frequency of your migraine attacks, maybe keep you from transforming into chronic migraine. And when it comes to doctors and nurses, I really encourage you to find doctors that you feel good with. They are here to work for you, not the other way around. So if someone makes you feel uncomfortable, if you have the capacity, try out a different provider. I've gone through many providers. It's exhausting, but I mean, we're dealing with enough in our lives. We can't be getting harm from that angle too. And hopefully, as we push forward and talk more about these disparities and doctors educate themselves on how to be more safe for their patients, these disparities will shrink.
Thank you so much for sharing that. There was a question about what is a patient advocate? Do any of you guys want to tackle that? And then I have something to say after.
I'm happy just to say, surely for me, I think it's on so many levels. I started being a patient advocate 10 years ago when I got chronic migraine. I had to advocate for myself to the doctors all the time. And as we all shared, we went to Headache on the Hill, which was an event to speak with Congress about headache disorders and migraine. So there's like multiple levels. We talked about the need for more research, participating in research. I think especially if you're queer, and we need more representation, that can be a way to advocate with others.
That's really the same thing, Yuri. I started off, I wasn't always in this quote unquote patient advocacy role. I just started speaking out on Twitter and just talking about my experience of what it was like living with migraine, what it was like trying to find a doctor that, saw my migraines as more than just quote unquote anxiety. I I started becoming an advocate on Twitter, and I started speaking up for myself at doctor's appointments. And then as you all of us have said, once headache on the hill. There are so many ways to be a patient advocate that I think a lot of people, they hear the word patient advocate and they think it's like such an official title, but basically just speaking up for yourself, talking about your experience, taking a picture, and saying, I have migraine, something that 8 years ago, I didn't have chronic migraine. And I remember the very first time that I said to somebody that wasn't within the migraine community that I have chronic migraine, just you being an advocate, talking about your health with family members, with friends, with people that aren't, maybe in the chronic migraine space. That's you being an advocate right there. You don't need to put on a suit and tie and go go work a job. You living as a person with a chronic illness is yourself being a patient advocate.
And you advocating both for yourself or your friend or your partner, all of those are being a patient advocate anytime. And I was just going to say, from a physician perspective, I've seen the healthcare system change a great deal over the years, but we're still not graduating enough physicians to meet the need and the demand of the retiring physicians. And so you get many generations of physicians in training, and some people evolve with time and some people unfortunately don't. And I think you were absolutely right, Yuri. You have to find someone who you connect with, who you trust. We have gone from healthcare being a dictatorship of doctor says do this and you go home and do that to I know my body. I know I sit down with my patients and I can rattle off data. But in the end, if they say I'm not comfortable with this or I don't think my body will handle whatever we're talking about, we move on. And that's really important. We have to have that conversation. We have to be open on both sides, hearing from the physician why we're offering those treatments and why we think it may or may not be helpful. But at the end of the day, it's a partnership, and that is so important. And I'm hoping that I'm imparting that on the residents and fellows and medical students that I have the opportunity to teach. And hopefully we're breeding a new empathetic generation that thinks about these things a little bit differently. But I love that you had said, find that fit. And sometimes that's really hard. A lot of folks have seen many physicians before they come see me. I get lucky every now and then and get to be the first. Let me see if we have any questions yet. Let's see.
And I will just say quickly, I thought of it after that. If people are interested in being a patient advocate in some kind of formal way, there are several trainings out there that you can go through for free through different organizations. So we can always send links for that. American Migraine Foundation has one, in fact.
So one of our questions here is, we mentioned working to find the right doctor and knowing that it's different for every person, but how would we advise folks to have that conversation, what questions to ask, and how do we find the right fit? And I'll say sometimes that's really hard. I know that both neurologists and headache specialists are kind of in zones, and there's definitely healthcare deserts is what we call them on the healthcare side of, there are areas that just have a disparity in the amount of providers for patient population. And so some people really have to travel to find those physicians, which means time and energy. And there are these great resources with the American Migraine Foundation. And there's actually many other resources through CHAMP and other headache groups that might point you in the right direction of providers in your area. I think telehealth has been helpful with that, but unfortunately, medical licenses don't cross state lines. I don't know why, besides a financial incentive potentially, because I think my advice in New York is the same as in New Hampshire. But those are some of the limitations, unfortunately. Do you guys have other advice?
Yeah, I'll hop in. There's some things I do. I go to my local LGBTQ community, so our Pride Center, and I ask them who are the physicians and health systems that they know are LGBTQ affirming. I think that our community is very smart and organized in general as a LGBTQ community, and we look out for each other. So have those conversations with other members of your community, either locally or in your state, about who has worked for you. Who is the person that hasn't misgendered you? Who is the person that has the rainbow and trans flag in their office? Who are the LGBTQ doctors? I ask that all the time I'm at conferences. Where are you? I would like to meet you, and I sometimes do, but it's important for us to see who are the people who are us, because we need that representation. So start with your community and ask.
And I would say from my experience, it's unfortunately just like migraine treatments. It's really trial by error, by fire, by error. I don't know. You have to try it and see who works for you. Like no matter what reviews I've read, and I have to sit through sessions, which means the time and the cost, et cetera, to realize like there haven't been exactly questions that have helped me kind of weed out what practitioner is going to be good or not. It's just more based on the nuances and the experiences with them. That said, I totally agree with Joe, and there are online resources. There's directories of LGBTQ providers that you can find. So that is a good starting point as well.
Go what Joe and Yuri were saying was go to the community. They usually know where, you know, who's where, what's happening, who's the most gender affirming, and who's just somebody who's also going to advocate for you. That's really important to have, you know, not only for me, I've been through so many doctors who had deemed me a problem patient because I have my migraines were so severe and chronic. And then I finally met a doctor who was like, this is unacceptable. We're going to keep fighting and advocating for you. So it's also about kind of like what you were saying, you know, a feel and just, and it's not easy. It took me 7 years to find, and it shouldn't take that long. I have to say it should not take that long for you to find a doctor that's going to give you the right kind of care, to give you, and who's going to advocate for you, you know, and that's why community is so important, and having that social support system is also important, to know who to go into the community who's going to, you know, that you have to waste 7 years of your life trying to find that right doctor.
Yeah, so it sounds like it's an individual fit piece. I agree also that it's hard to just find it online. Sometimes it is meeting the person and seeing what the personality is. There's very different personalities in headache medicine and in neurology and in internal medicine and family medicine. And everyone has a different fit. You're right. Looks like we have a change in gear to ask a little bit more about research, and have we seen any migraine studies that are gender inclusive outside of the binary? Have you guys had any encounters there? No? I'd say that, go ahead.
I'm not sure if you mean if the question means outside of the binary, meaning like including other descriptors. Like basically the identifiers I've seen in the studies so far have either been heterosexual, not heterosexual, or possibly the one that broke down with bisexual versus not. So no, this research is pretty limited so far that I'm aware of.
That's pretty much what I'm seeing as well. And I think part of the trickle-down effect is that most of these research studies are years in planning, and they're probably going to be slow to catch up with the times from just knowing how those come into view for us. So there's many drafts and things like that. So it's years in the making before it comes down to patient care. And my guess is that'll become more inclusive with time here, because I think there is an increased awareness that people need to be identified, that we need to study subpopulations as well and make sure that they're represented in our groups.
And I would plug the Pride study as a resource. They're PCORI funded, a large research net that has different areas. It's not neurological specific, but they are looking at the broad spectrum of health in the LGBTQ community.
And I'll jump right onto what everyone is saying is too is, you know, we have to make noise as a community. You know, your voice matters. And I think the more like finding organizations like the Global Health Living Foundation and, you know, on a panel like this where we're elevating voices that typically have not been heard in the past. I know for me, I was one of the first queer people that I seen talking about like are there any queer people with migraine? Like what's going on? What's happening? I know that we're out there and we are out there. So I think the more that we make noise, the more organizations amplify and center our voices, the more we'll start to see more surveys and more research and more things being done like this as well. It has to come from both sides. Have to come from the side that's going to listen to us, and it has to come from inside ourselves as well.
And I think the changes are starting. And I think that this community is doing a very good job of raising awareness. And I am so happy, again, to be part of this panel and kind of including this great group of people that have joined us this evening. These are such important issues to continue to talk about and bring attention to. Taylor asked if there's a Facebook LGBTQA plus community migraine group specifically on Facebook or other social media groups that they could connect with. I know there's migraine groups. I don't know if there's a subgroup.
I don't know if one exactly exists. I know like there's queer disability spaces online that I've seen, but I haven't really seen, you know, an LGBTQ focused migraine support group out there. But you know what they say, if you build it, they will come.
You took the words right out of my mouth. Let's see.
Yeah, I'm just seconding that. I've spent like the last decade with chronic migraine and on Facebook groups, and part of why I ended up starting an Instagram migraine talk and talking about this and then reaching out to Sarah is because they're predominantly straight white spaces, female, and of a certain age group. And I find a lot of support in them, but there isn't that representation. And I would love to see that group myself, also for people of different races and ethnicities. It's just like a real gap, I think, in the support groups. But we have different organizations that are supporting us. But in terms of like specifically the question of a LGBTQ specific migraine group, I have not seen it. I would love that if somebody wants to help start that.
It sounds like we've made an initiative today. See if someone will take it up and champion it. I have another question. Do we have resources for primary cares, PAs, nurse practitioners to receive migraine training? And yes, there are resources through the American Migraine Foundation. There's a National Migraine Foundation also has resources and a certification for nurse practitioners. So it is out there, and certainly groups are seeking it out. I know that the curriculum in the American Headache Society is designed by headache specialists for primary care, and we put on every November, there's the American Headache Society includes a meeting. A part of the meeting is actually basics of headache management and kind of for starters. We often send new nurse practitioners and PAs within the headache groups, I know, to get trained, and it's an opportunity that's open to anyone who is interested. They don't even have to be members of the American Headache Society, just have an interest. So I know we plug that a lot to our colleagues and folks that show an interest in treating patients that have headache disorders. I don't have any more questions right now, but is there anything else the group wanted to bring up and make sure we touched on?
Yes, I would just like to, we can't have this discussion without acknowledging the moment in time that we're in, where LGBTQ people are under attack, particularly trans people. Look at the headlines about drag shows having to be canceled because of threats of violence, legislation being passed in states like Don't Say Gay. That message trickles down to us in all facets and aspects of our lives. And we can't forget that our doctors and healthcare providers are also part of that system that are getting that same message, that can either be allies or perpetrators of violence against us, that can speak up against it or can participate in it. So we have to acknowledge that right now, the community, particularly those of us who are most marginalized, are dealing with a lot. And if we're in front of you, and I'm speaking to the healthcare providers now, know that it's taken that person a lot to get there, and treat that person with respect as if that was one of your family members that you knew struggled to be in this appointment, to get the help that they desperately need. Because we're getting killed out there in society. We shouldn't be getting killed in our physicians' offices when we're trying to get treatment to feel better. So we can't have this talk, and I'm sorry for being a downer. We can't have this talk without acknowledging the reality that we live in, the reality that so many of us are dealing with that impacts our health and care.
Yeah, I agree. The healthcare space really needs to be a safe space for all that seek it. You're absolutely right.
In that same vein of Joe talking about, the very serious issues that we're going through as the LGBTQA plus community, he mentioned to talk about allies. We also need allies on both sides. We need people standing there fighting along right with us and supporting us in the migrant community. If there's there was an article that I had written a few years ago, and it was talking about living my life as a queer Black woman, and it received a lot of homophobic comments on it. And I think thinking back to that, when we see those comments online, when we see that, that's very triggering, that's traumatizing to see homophobic slurs being written like that, and to not have people and organizations jumping in to stop hate like that. So we really need a collective effort from physicians to other organizations to other migrant patient allies. We need everyone's support. We want to feel better just like the rest of you. And we definitely need support from all angles.
Well, it looks like we are getting into the end of our time together. Are there any closing thoughts before we leave? Well, I'll say thank you to everyone who joined us. I hope that we have offered something new, a new tidbit of information this evening, made a new connection, maybe scratched an idea, and have a really wonderful evening.